FADIC offers a variety of international online trainings accredited by FADIC and provided by well-reputed professionals in the field, which means that you can always keep up with the latest topics in your specialty wherever you are and whenever you need it.
السلام عليكم ورحمة الله وبركاته. أول شيء الحمد لله والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. في البداية أمسيكم بالخير وأتمنى إن شاء الله تكون هذه المحاضرة مفيدة لكم في عملية التحضير لملف الميديكيشن مانجمنت، وبإذن الله إن شاء الله نحصل على الفائدة من هذه المحاضرة. أنا عارف أن المحاضرات تكون طويلة لأن البرنامج هذا يعطي تقريبا يقدم على شكل يومين، ولكن إحنا قلنا بس عملية briefing orientation about the standard and what the substandard and what the requirement and what the activity need from us to prepare for survey. احنا ذاك اليوم تكلمنا، ممكن احد الزملاء سأل عن موضوع الميديكيشن مانجمنت، وتكلمنا عن موضوع انه the standard this is a top and substandard who is already the one who already will be evaluated from 0, 1 and 2, and sometimes will be not applicable in case of this not the scope of the hospital. As I told you also, we have document review and document evidence and staff interview and observations and personal files. All this will be for each substandard. The certifier, when we come to your hospital, they will look for this one. That means if you're looking here about hospital has a system, the hospital has a system for managing of use of verbal and telephone order of medications. This is as a standard. About substandard, what will be already will be measured. The hospital has a multidisciplinary policy. That means the certifier he will looking for the policies, and this policies should be multidisciplinary. Multidisciplinary, that means is prepared by hospital-wide. For example, 4 pharmacists there, nursing is there, and physician is there. And according to that means who do verbal and who do telephone order and who's received the telephone order, who's not. That means should be all the people available and preparing and reviewing and approve the policies together. The certifier here, he will looking for the signatures in the end of the policies, and also he will looking for this policies. I received one questions from our colleague. They said, in case of the patient safety, they are doing this policies. I will do again another policies. No. If you're doing this policies from education, from patient safety department, but it's covering all the substandard requirements for this 23 medication management standards, okay, accepted. In case of not covering, you want to add it there, or you will prepare your policies and you will put it your reference the verbal and telephone order what already prepared by the patient safety director or safety department. The hospital have understanding the proper. Here we are looking for when we are using the verbal and telephone. This is very important for us because will be lose the patients in case of some emergency, and we should also looking for when we are using the verbal and when we are using the telephone order. And this is you see looking for the activity staff interview. That means he will ask the pharmacy, and he will ask the nursing, and he will ask the physician. Be careful in that one. Based on your policies, to orient your staff and train your staff how they will be understand your policies. Emergency cases, what already need will be affecting the patient. For example, the patient life, or urgent. That means as not will be affected now, but need to be looked for it immediately. you should mention there and define what situation you would use verbal and telephone order. And also they were looking for document review open medical record. When you are using telephone order or verbal order, when you are documented. For example, a verbal order should be documented after the emergency case finished. And when they are finished, should be the physicians and nursing document everything happens related to medication and sign and stamp in the medical record. And then the telephone order, the time frame for it within 24 hours should be seen by physician or by the one who's made the order, telephone order, and approve this one, because sometimes the consultant is in call, but the nursing, she communicate with him and about one patient and he give order. Also, you must mention in your policies related to repeat and read back. This is very important. You want to read back and repeat it back in case of verbal and read back in case of the telephone order. And nowadays they said, even GCI, they said read and repeat back immediately at the same time. This is very important also for us to look for it during our preparation. If you're looking for 24, the hospital has a system for prescribing non-formulary medication and prescribing the formulary medication for off-label unapproved medication investigations. This is only when you have a medications, this medication is not in the list of your formulary, or not, for example, if you're a Umwach hospital, is not from the Umwach hospital formulary. How can you deal with it? You need here also document review. That means you need a clear policies, and should be the policies multidisciplinary policies and procedure and prescribe non-formulary medication. You need to looking for here a policies. Second one, 24.2, the hospital multi-disciplinary process prescribing formulary medication. They have also, he will looking for this one in the policies. There's a clear documentation. He needs here to looking for document evidence. There's different document review and from document evidence. Document evidence here, we want to see the non-formulary drug request form. That means you are in a hospital, you should have a form, and this form should be clear, and also the sequence of approval. They will come in the next standard. There is a clear documentation also for a special request form. What is the indication for that one, and how you will be used, and when you will be used, and how can be initiated. That means the physicians, he will initiate it, the chief of the department, he will be approved, they will be shifted to the pharmacy therapeutic committee, the pharmacy therapeutic committee, they will be approved. That means the sequence in the form FADIC, and the certifier, he will looking for one or two example of that doing inside your hospital. Even he will also ask in the 24.6 pharmacy therapeutic committee, he will found it some document evidence related to one or two or three example documented in the minutes of the pharmacy and therapeutic committee, and also approved by the committee. And during the meeting with the committee, he will ask a question about the process. How, in case of non-formulary medication or off-label, what you will do for it, how you will fill the form. He needs staff and also a member of the committee aware about this process. Please be careful. It's not only paper and policies and like this. He needs certifier to proper implementation for that. You do that, maybe you will have a good and nice policy procedures. You have a good and nice form, but when he make interview with the staff and when he make interview with the committees, nobody aware about it, even if they are documented in the minutes. Be careful about it. 25, the hospital has a system for reviewing the appropriateness and medication order before medication is dispensed. This is also here, you need document evidence. The hospital maintain an updated and complete medication profile, electronically. When any medication you wanted to be dispensed, the pharmacist, he has able to looking for the medication profile. A trained pharmacist reviewing all medication order or prescribing before dispensing. They will be accepting here for emergency. When you say accepting, that means in case of emergency, you are looking for the patient life saving, but you are not looking for that documentation. But in case of inpatient and normal order, that means pharmacist and trained pharmacist, he will look for that profile and he will see the drug-drug interactions, and he will looking for the patient allergic, approved indications, a drug for interaction, appropriate specification, dose, frequency, and everything. Here, if you're looking here, activity staff interview. That means staff interview, he will ask the pharmacist in many area, OPD or inpatient, ER, for example. In case he will certifier, he will ask like a scenario. In case if you found like this, what you will do, how you did. He show me what you will do in case of something like this. How you communicate also with the physician to correct the situation. 26, the hospital has a system for preparations of sterile compounded preparation. Here we have 26, 27, 28, and 29. All this standard, and this is very important standard. 26 talking about sterile compound, 27 talking about TBN, 28 is talking about chemotherapy, and 29 talking about non-sterile compound. Here we must, it's very clear the standard, substandard is very clear for us in case if you have this, but like now 26 points, the hospital has a manual, you need a manual for proper aseptic technique for intravenous infusion. You need also, in case if you didn't have laminar flow and you didn't do it inside the pharmacy, should be all staff upstairs aware and trained and certified for that one. And here also talking about pharmacists should be certified and trained. In certified, he went, for example, to King Faisal Medical Hospital or King Fahad Medical Cities or another big hospital. Other hospital. This one will be and not less than 4 week training, not only to attend a course for 1 week or 2 days or 3 days, not less than 4 weeks, and should be also give a certification and sign that that's an institution who give this training. I think we need to work very carefully about it. I'm not talking about only steroid, we're talking about chemotherapy, we're talking about TBN, should be send anyone from pharmacists to that places and to take training there. And I think if you communicate with Ministry of Health or communicate with other hospitals, they will be accept you to take this training there. 26.2 sterile compounded preparation performed pharmaceutical care accepted during emergency. Case here, see here, 26.2. This is very, very important substandard. You're talking about should be all sterile compound performed by a pharmacy. In case of an emergency, yes, it should be done, for example, inside the ICU or in the ER, for example, for any emergency cases, they can do it. Or anyone who can do this compounded sterile, they will be should be competencies test, for example, nursing, and also they have assessment and evaluation and certificate prepared for them. Also looking here for personal file review. That means the certifier, he will looking for the personal file. So when they go around upstairs, he will meet one nurse or two nurses. She prepared or she asked her and she said, yes, we prepare some IV pictures here. And we are mixing the IV and we give to the patient. And he told her, what's your name, please? He will take her name and he will ask the personal files of her. That means here, be careful, all the staff who's responsible to prepare the IV should be trained and they have a competency assessment in their personal file. Aseptic technique also, they have a manual for aseptic technique, and this aseptic technique is also the equipment, and they were looking for observation. Maybe they will ask one nurse to prepare for him something in case if he didn't found any case. This happens, and also from nursing certifier, he will ask about this issues again. Visual inspections, he needs here, they have some inspections before you dispense this one about discolorations or evidence of loss of intake. Anything should be commented like a checklist. Yes, color is okay, no, nothing there, very clear, and no. And this will be before you dispense your sterile compound. The pharmaceutical care clean rooms, they were looking for the pharmacy rooms what already prepared for sterile compounded, and they were looking for the design, and you say here about design of the United States Pharmacopoeia 797. This is the United States Pharmacopoeia National Formulary USB NF compounded to drug standards, establishing best practice and registration of products compound sterilized. And also, as I told you, they need also for the one who's preparing this sterile compound, it should be have at least 4-week training in a big centers. They're talking about laminar flow, and I think laminar flow, airflow, this is HOOD is tested at least every 6 months from the, and according to the manufacturers. And this is biomedical they are responsible about, but at least pharmacists, people, they are looking for them to inform them about this. Implement a written approved guideline for intravenous. They were looking for this also. Sterile preparation compounded outside the clean rooms. In case of any things outside, they were looking for it in case of emergency situation. And they need the pharmacy, and regularly at least once a month. Pharmacist staff should be at least once per month. As I told you before in the part one, we do a crash card round and check every month. You can make it in the together with the crash card, with all medication in the floor stock, and also for sterile compound, everything, and antiseptic technique at least they will do by this one. The pharmaceutical as mentor performance qualification and pharmaceutical permitted prepare sterile compound medication outside the pharmaceutical. This is pharmacy monthly evaluation, nursing staff performance, IV admission. They will do document evidence how you are make a test on how much you are working with the nurse. Guideline also, and this is as I told you in the beginning. 27, they are talking about, as I told you, TBN. Almost the same of the IV, only looking for the TBN. They're talking about emulsions and other equipment should be available there, and also clean rooms and under laminar flow, environments, pharmaceutical care. I think the pharmacist who's going there should be trained in the IV TBN chemotherapy in case your hospital they are providing chemotherapy or they have oncology centers. They should train in that. And the certificate, what they're given to him, should be clear about IV admixtures, for example, TBN and chemotherapy or something else. Okay, what already he did. See here about observation, document review, that's mean policies. And that's 27.1. 27.2, they're talking about observation, staff interview. All parenteral nutrition products are compounded in the pharmaceutical care clean room and the element. That means we're looking for staff interview and observation. At the hospital permitted only pharmaceutical care staff qualified. They were looking for observation, and he was looking his personal file review. That means he was looking for that certificate and competence. Aseptic technique strictly followed by all staff. This is by observations. In case maybe the certifier, he will ask you how you are dealing with aseptic technique and how to be wearing the prevention precautions equipment and how you are dealing with that situations. Maybe you found you are prepared already, and he will looking for you, and he will looking for you. Are you following your aseptic technique manual or not? Double check also. You wanted to looking in your policies should be mentioned there. Double check This is by observation. He will look, and he will read it in the policies itself. Essential macro and micronutrients should be available there. Appropriate membranes filters are available for different type of parenteral nutrition. And this is also he will looking for by observation. The hospital implement a written approved guidelines, stability, compatibility, same what we talk about it in the IP and when we talk about sterilized compound. When a parenteral nutrition product are compounded by outside vendor, here same also what written there, and also in the chemotherapy they written there. In case if you are provided from other places, in some hospital, in case TBN he didn't prepare it, but he contract or he make agreement with other hospital. Should be that hospital is also following all the standard requirements and all antiseptic technique and all infection guidelines and prefer to be accredited hospital. And sometimes your hospital is 200 beds or 100 beds and you don't have TBN, but you can also asking from the other hospital 300 beds or 500 beds already near to you, not more than 30 kilometers or 150 kilometers. And already you have agreement, and this agreement including everything related to the substandard we'll talk about. Antiseptic, guideline, how to prepare it, and what the metering there, and how they are checking their laminar flow, and how they are disinfecting the laminar flow. Everything written in the guideline, what already approved by them, and what already agreement according to that. There is 28 is talking about, as I told you, chemotherapy. In case if your hospital has oncology unit or department, and he need to be prepared for them as a chemotherapy, almost they need the policies, like what I told you, policy in sterile, policy in TPN, and policies in the chemotherapy compound preparations. And also he was about services and also the managing of the pharmaceutical care should be under the pharmacy. He will ask interview. Hospital permit pharmaceutical care staff qualified. As I told you, should be trained, and we did for him a competency test from a big centers like in Riyadh or in Dammam or in Jeddah, for example, or National Guard or in the King Faisal Specialist Hospital. What already he has like this facilities, and he can train the staff related to the chemotherapy compounded preparations. See here also looking for the observation and personal file review. We should very clear for us observation and personal file. So we should put their papers about their certificate and training and competencies. Same what we talk about septic technique, visual inspections, chemotherapy compound areas physically and functional, separate area to maintain the product sterility and prevent cross contamination. Should be separate, is not mixing with the IV and others. The hospital use of chemotherapy cell box plastic bag. They were looking for the plastic bag, special protective material such as gloves, gowns, masks. Should be everything available in case if you are providing this service. Chemotherapy also spill kits available in all area in case of some spill happens and you wanted to deal with it, should be available there. Relevant staff are trained in the proper handling of the chemotherapy spills. He will ask you, and he needs also training and certificate. The people who is working with chemotherapy and they doing compounding, they should be trained and certified, and they will ask about something related to safety in case if something happens, or how you will deal with it. You need the pharmacist or the pharmacist who's there to tell him how he will work in that and how he prepare it and how to be clear for him. everything related to chemotherapy product should be covering by the policies and should be covering by observation and the evidence of the implementation. The 29, we are talking about here non-steroid. In case of you are preparing some non-steroid, can like cream or like nasal, like normal nasal drops or something, cream or emulsions or something related to that non-steroid compounded preparations. You should have a place for that one. First one, as I told you, policies, and should be this multidisciplinary policies. Maybe sometimes preparing outside the pharmacy or pharmacy care has proper facilities for that one. Be careful about non-steroid in case if you have these facilities. Some hospital they said we don't have, we cannot. Everything is available from Ministry of Health, from the medical supplies. But be careful. The certifier he will ask, and he will be asked upstairs in nursing, and maybe he will observe some medication or some patient. He has the same preparations, and he will ask from where you get it, and he said from pharmacy. This is not good. You should tell him what you have. You can do it in the proper way. You need a place. You need all the equipment. Need for non-steroid area should be available. Mortars, for example, measuring cylinders, everything related to that should be available. Eye wash, water wash, this is eye wash in case of something. Spill kit, MSDS, this should be available everywhere. MSDS, all the equipment and volatile equipment should be written and keep it in one cabinet and written, clear labeled. And also the need from, you have a manual inside this sections, and the pharmacist was working there aware about everything, and also in case of some spills happen there, should be aware how to deal with it in case of this is chemical spill. Available and staff aware how to deal with the situations. Also, if you're looking for 29.6, same what 26, 27, 28, and 29, all in case if you are receiving from outside or other hospital or other companies or something else, should be you have a good and clear agreement, and that hospital or that companies, they have all requirements by standard and substandard from infections, from guideline, from aseptic techniques, whatever there should be available there. 30, medication management 30 is the pharmaceutical care enforce the hospital guideline for infection prevention and control. Look for all area where medication are stored, compound, preparation, dispensing, and dispensing are clean and well organized. This is by observation. When he went to pharmacy, he wanted to be clean. Some in GCI, for example, not in Sbahi, but in GCI also. And also Sbahi, sometimes they will ask about it, about carton should be not available in the pharmacy. Carton should be outside. I mean the big carton. It should be not entering the pharmacy. That means from store should be removed there. And before entering the pharmacy should be only the small carton, not the big carton, the pound one. Because they said this is shipping from many countries, and this is maybe they will transfer or transmissions or transfer the infections everywhere. Also here about pharmaceutical care has separate housekeeping material, dedicated for a clean room. He will go to the housekeeping or store for medication, and he will looking for it's clean and also organized well. For example, as I told you in the beginning, in the part 1, stores, when you are at the stores, should be 45 centimeters from ceiling, and from down should be not less than 10 centimeters, and also not in good shelving and labeling, and expiry date is there. and the area should be clean also. And as also we talked before, the room temperature is measuring, and the refrigerator temperature is measuring, and the refrigerator, for example, is connected with اللي هو emergency power. All these things should be clear, and the pharmacist chief and pharmacist, quality pharmacist should know about it. Also, he's talking about antiseptic soap and sink should be available in pharmaceutical care department, and the area with the medication store, compound, preparation, dispensing should be available also there. By observation, you will look flammable and volatile substances are stored in the separate cabinet. Spill kits and personal protection equipment, اللي هو PPE, are readily available. He will ask about and he will see by observation. For staff involved in handling chemical and hazardous materials such as chemotherapists who are attending the receiving pregnant should be clear there about the precaution they will do with it, and they will ask staff there how can in case of like this. Material and MSDS, as I told you, MSDS, that means all chemicals available in the pharmacy should be labeled, and they have a list according to the manufacturers and how to deal with this chemical in case of something happens. And the file is available in the pharmacy, and all staff aware about it. I don't want the one who is working in the lab, he will be aware more, because sometimes something will happen in the evening or the night, and the section is closed, and maybe other staff who's coming in the evening and night, they are not aware about it. Hand washing, the certifier here, you're asking from a pharmacist and who an inpatient, outpatient, or something like this. He will ask him about hand hygiene, to perform hand hygiene very well. Should be all pharmacist staff aware how to be perform hand hygiene technique. And may will ask when you will use hand wash and when you will use alcohol gel, for example. As a quality, as a fiction guideline, he said, if you have a visible soil, for example, in your hand, you will be doing a hand wash. In case if you only from touching a patient or surrounded the patient or something related to that, you can deal with that alcohol. The standard precautions should be available. Also, as food and drink or smoking is not allowed in the pharmaceutical care department. He will maybe open the refrigerators, and if he found your policy said it's not allowed to be eaten inside the pharmacy, they will open. Talking about laminar flow, how you are maintaining and checking the cleaning of that, replacing filters. This will be clear in the guideline if your guideline as a, and this is also about guideline of infection should be approved from infection control department. Should be signed there, and he know about even how to deal with that laminar flow. They have special technique how to be clean and laminar flow. I think the people who's expert in that, they know how to deal with it. Or in case if you don't have any idea about it, you can communicate with the infection control department. They will tell you how you will do cleaning for that laminar flow. You need also to looking for document if it's schedule. For example, in the end of the day or second day or every shift should be scheduled very clear for cleaning of the laminar flow schedule. Be careful. Here is document evidence. That means you need this schedule. Table monthly or weekly, and approved and prepared by the one who supervises this area and approved by the pharmacy chief. 31, we're talking about the hospital has a system for safe dispensing of medications. We are talking about hospital has uniform system for dispensing and distribution of the medication. He will looking how you are dispensing the medication. The hospital dispense the medication all by observation. Here we're not looking for the policies. We're looking for how you dispense the medication. In case if this is readily to make, such as repackaging units, doses, in case if you wanted to give and repackage the units, because you don't want to give more than needs, patient needs. That means some mistake will happen. The good things to be repackaging unit doses is very important inside the pharmacy and dispense for this will use as a single. The hospital dispense a quantity of medication consistent with the patient needs. This is what I talk about. It should be there if you have unit dose, or they don't want to be looking for a floor stock and let other non-pharmacist staff, they will be responsible for dispensing this medication. May will happen, but try to minimize as much as possible. Hospital no more than 24 hours, like unit dose. As we talk in 31.4, they need unit dose for every patient, not more than 24 hours supply to medication. That means this one, if you didn't have unit dose, the certifier, he will not give you fully. They will give you zero here. Be careful. You should implement the unit dose system in your hospital and accept for that liquid, for example, syrups. Maybe you cannot repackage this one, but you can dispense it as a bottle. This is you can written very clear for you and also accepted. But when you wrote this one, should be written there date and time of opening, and this will become in the second step. Here also we should very clear for us what means for stat and what means for stat and new and routine, because stat, for example, the medication must be administered within 30 minutes of time of ordering or communication by prescribing to the nurse, and the stat needed to be given now. New order, for example, the medication must be administered within 2 hours of time of the order is written. Routine order, in case of this routine order, that means you wanted to give this medication for next, for the time for ordering. This is for administer at the next routine administration time. Some hospital they will say 6 to, in case PID, this is 6 to 6 or 8 to 8. And that means in case if this is a routine order and this dispensing will be in the morning after 8, when they're receiving by nursing, she will give the medication for the patient in the 8 p.m. But in case of this stat, should be given to the patient within 30 minutes. And they will reveal that unit dose for the patient to give him second dose in the evening time. In case of this is a new order, but not stat, should be given within 2 hours. This is according to your policies, or maybe you have other evidence-based. This is for example only. In case if you have other evidence-based practice guideline, you can follow this based on your hospital guideline. The hospital maintain record for all dispensing medication. Should be you have maintaining the report, and the hospital, they know what they're dispensing, This is for unit dose especially, like one profile, for example, medication, this medication or unit dose for male medical, this is surgical, and this is, you have at least all the paper within last 1 year or 6 months document available in the pharmacy. Also, we're talking about 31.7, talking about double check. Talking about not intended immediate administration. This is, I'm talking, already I talked about it and very clear for us in emergency rooms. This is 32 about labeling. And important here, you would see the label and how they label, what availability of the label. Looking for 32.4 should be all this available from 1 to 6 should be available in the label by also 2 language for the people who don't know at least 2 language, because to be understanding how they will deal with it. Or compound intravenous mixtures should be also labeled with diluent names, concentration, and also volume. It's very important. Compound parenteral nutrition, also they have special label for that. Outpatient medication, also they have special. And see here, the containing the language and form of the patient can be understood. And in many form, and I think available everywhere now. In case if you are using electronic, or in case you have manual, you can put it one label and you can write in that. But should be your writing is very clear for the patient. 33, the hospital has a system for obtaining medication when the pharmacy is closed. Here we're talking about in case of the pharmacy, some hospital made the pharmacy will not work 24 hours. That means how in case of need, patient need the medication, how the non-pharmaceutical staff like a nursing, they will work in that place, like in floor stock, for example, and you must put it a list. I will not go through that substandard because very clear. Only they need here a list for approved medication or accessible non-pharmaceutical care staff. This is 33.3. He needs the document evidence. That means certified. He will ask about that list, what already accepted to be given by the non-pharmaceutical care staff, like nursing or others, to give this medication. But also he needs also here a one-call pharmacist in case this is not in the list and you need other medication. That means you should communicate with the pharmacy on-call staff, and from that one you will be clear for you to be do it this one. 34, they were talking about handling recall. This is very important for us to understanding the recall, because it should be here we need a multidisciplinary process. Multidisciplinary, that means medical supply department should be signed with you, pharmacist and nursing and physician should be signed in that process, because they need it to be when they recall this medication or came any memo from Ministry of Health or came from FDA, Saudi FDA, but reversible. In case other one, class 3, this is not likely to cause any adverse health consequence. You should mention there how also with each class how you deal with it and how you are retain it from the units and from pharmacy to the medical supply and medical supply to the company or to the main medical supply in the region, for example. Otherwise, in case of this is class 1 or class 2, how you communicate with the patient, how the accessibility for the patient profile to be call him or through other medical record, for example, department, to call him and let him to be retain this medication because of that one. You should be clear in your policies how can you deal with that recall medications. They will ask also the pharmacy therapeutic committee, and they will go to the handling record when you receive this one, how this will be stored. And for some hospital nowadays, they receive it down to medical supply, put it in some area, and they said this is already recalled medication, and they are waiting for the company to come, or they are waiting for another order, another memo came from ministry related to that medication. 35, we are talking about outpatient education and counseling. This is mainly talking about counseling, and you need to hear about verbal and also sometimes by brochures or sometimes by other way for counseling. And our should be mainly they will ask me inside outpatient, also inpatient. You should be clear in your policies if you have policies related who will do counseling for discharged patients. Some hospital they let the nursing to be given like PFE the patient family education teams, they will give counseling for that patient. But important things, pharmacist, he's the one responsible to make counseling for the patients inside when he discharged. Outpatient, during your dispensing the medication, he will looking here about how you make counseling for the patients, how you tell him. Maybe he will found one patient during his round, and he will see how you are make counseling for him. Also, he will looking for privacy, because counseling should be with privacy. This is very, and also here talking about 36.4 qualification and experience competency assessment for the one who gives counseling should be have good orientation, training, and competency related to that one. And he was looking for the personal file. He attended a lot of courses, for example, and he went for a training in the big centers related to that one. We are talking here about hospital has safe system drug administration. This is very important for mainly nursing. They need to document if it is hospital-defined nursing, other clinical staff authorized to administer the medication. Should be also people's or name of the nursing force authorized, like you said, registered nurse. Document that define nursing and the other clinical staff who authorized to administer medication. You can say, for example, nursing. For example, physician can be also sometimes administer medication, and you can clear in your policies. Qualification and experience can be same. The people who administer this medication should be trained and qualified, and they have a competency test related to that one. The hospital has a guideline for safe administration of the intravenous pushing. All this should be staff interview and pharmacy therapeutic committee. They will ask how they will be approved this guideline. The hospital approve and disseminate implementing guideline standard drug administration time. This is also when you put it a standard time for administration of the blood of the medication. He said here he will ask, we're looking for open medical record. You will see one open medical record when you start. For example, if you say 8 to 8 BID, he will looking for BID patient receiving medication, and they were looking start 8 and start second 8. They were looking for nursing progress notes or the medication profile sheet. The hospital maintain and care record the whole disposable and use portion of narcotic. This is according to the guideline, and everybody they know about it. 36, they are talking about safe system for drug administration. This is same. This is repeated. 37, the hospital has a system for reviewing and verifying medication before administrations. This is, you need a hospital implement a multidisciplinary process for procedure for proper verification of dispensed medication before administration. اللي هو the 6 right, or some others hospital they say 7 right for dispensing of that medication. Medication verify also from medical and medication administered prescribed does not by corrected route. Should be all standard administration time. Medication administered verify expiry date before dispensing. There should be staff aware about all these things. Even nursing, not only staff being pharmacists, outpatient pharmacist, ER pharmacist, ER pharmacy staff. And also related to that, people who's working in the inpatients, like nursing, before administering medication should be also looking for the expiry drug. See here, all the they were looking for staff interview, only medical record, open medical record for standard time of administration. See here the education patient, when you do education and self-administration for a patient self-administration, like for example inhalers or something related to the insulin, syringe, how they are using, because you wanted to teach the patient before he going to his home, should be available and documented in his file. Should be here inside your policies, should be and asking in case of the patient bring his some medication from outside, it's allowed or not. should be clear in your policies, and all staff they're aware not allow for administration of any medication brought from outside the hospital unless, for example, seen by physician and the physicians approve, treating physicians they approve this one because maybe not available in our pharmacy, or maybe this is already from the medication histories for patients because he do some operation outside in the big center. The hospital does allow administration free medical sample, and also we have should the hospital does not allow administration of free medical sample. This is very clear also for the in your policies. It's not allowed in case of any you're not administered for any patients. 39, we're talking here about response to medications. They are looking here for in case of the gift medications, you have should be policies for procedure of monitoring patient response to medications. You should have a policies for that one, and there is annual updated list. From your formulary, you should updated one list related to the medication when you give administered to the patient should be closely monitored. Maybe they will be affect the patient equilibrium اللي هو عدم توازن المريض, or maybe they will affect some related to blood pressures or other things related to that patient, and need closer monitoring from physician, monitoring from nursing, and should be, and pharmacy therapeutic committees should be aware about this list, and should be also all the staff aware of it from nursing and also pharmacy. Include, see here about medications, effort of patient clinical condition, as I told you, talking about adverse drug reactions. Here we need here a clear multidisciplinary policies, and this policy should be a clear definition of ADR, adverse drug reaction should be clear, and the treatment physician is notified appropriate time, should be clear in your policies when you are notified at the appropriate time. Please be careful. 40.3 is talking about staff interview. That means the certifier he saw the multidisciplinary policies, and maybe you're there immediately or within half an hour, within 1 hour, for example, and when he make interview with the staff, she told him different, and he go to the other unit, she give other answer, different answer, and the other unit different answer. Should be careful when we are dispensing this. And it should be this our policies. All the staff aware and trained about. The patient affect the ADR receiving appropriate care and appropriate time. For example, this is we're looking for open medical record. When you're looking for the patient who received this one and they have a drug reaction, how you are dealing with it, how you closely monitor, and how you are reporting, and what's happened for that patient after that. You need to also if you have a special form for ADR, should be available everywhere. He will ask about that one. By nursing should be bring it, or other places to ask. Documented in patient medical record, as I told you, when open medical record, he will looking for that patient who received an ADR documented in his medical record. Significant and serious also should be sorry. The hospital has a system for improvement ADR reporting. Should be asking, maybe this question will be for the pharmacy therapeutic committee, and he will say how you are, what's your system for ADR, and this is and also he will ask about you reported to the Saudi FDA, and he will looking for that reporting at what form you feel and you submit it. The last one, 41, is talking about has a process for monitoring, identification, and reporting significant medication error, including near misses, hazardous conditions, and at-risk behaviors, and patient for cause patient harm. See here, there is a multidisciplinary process and procedures handling medication error near misses. They need here and see, be careful. This is ASR, essential safety requirement. This means if you're not taking fully within this standard, maybe it will affect your score as a hospital score. Policies, he needs policies covering all definitions, clear accepted definition for medication error, near misses, and hazardous, and also everything will be clear in that definition. We're looking for also treating physician when you are notified the medication, what time, within half an hour, immediately, for example. Medication error reporting completing within significant time, for example. In our hospital, we said 24 hours should be filled and send it down to the pharmacy. The hospital has a standard format. He asking about format, special for medication errors. Staff are educated about process in case of medication error. Here, 41.7. This is very important substandard. Look for it. There is active reporting. Certifier, he will not accept. Hospital, he didn't have any medication. He didn't have any medication error reporting. And in some hospitals, they said last year we didn't have any medication error reporting. Unaccepted. This is, you should, if I went to pharmacy now, I will find a lot of medication error by no allergic status, no diagnosis, no dosage form, no frequencies not clear for, illegible handwriting, a lot of things there. Be careful. Should be here, written here, there is active reporting. Active reporting, that means you have good reporting system in your hospital. I know this is international. They are mostly of the hospital under-reported. But we try our best to increase them, and even in our hospital, we try to give a gift for the one who reports. And we have a monthly update for nursing, and we recognize the nursing or other staff who's reporting related to regard to the medication errors or any near misses or other things related to that one. We're trying to encourage the people to be report, because this is for improvement, not for punishment. The hospital has conducted root cause analysis. Here, you want a certifier to looking for how many reporting you have, and after reporting, some medication error will be serious, or sometimes near misses lead to sentinel events. Did you did root cause analysis for that or not? This is what you were looking for it, and did you did it in the proper way, and you did an action plan, and how you will minimize the errors. Medication error, near misses, and others in the medical record. I think medication error, yes, you can document it in the medical record. I think you found maybe near misses, you found some difficulty in the documentation in the medical record. But according to the standard, you must document it there. But the important things, the medication error, what already happened to the patient, should be documented in the nursing or physician notes for progress note or nursing progress note. Also, the hospital has utilized reporting data. What data you deal with that, how you deal with it, and how you are reporting, and how you work in it. This data, how you try to analyze, and how to be solve it in case you need improvement project. You wanted to looking for that. Very important. And this is also for Mr. Therapeutic review comment. The healthcare professional provider with a feedback. This is very important also. Don't let him to report only. When you do root cause analysis, when you do any action, you please give feedback to your to your staff who make reporting for that. At least he will see and he will feel he a part of this improvement happen in a hospital. When you give him the feedback, yes, we correct this one, we purchase this one, and we stop this one, he will see, oh, I feel proud because I stopped something big, serious issues, and will be affect the safety of patient. But because of my reporting, I stopped that one, and this is what we get him to do very well. The hospital reports sentinel event. This is talking about in case of this is medication or lead to sentinel events, you should reporting to CBAHI, to the relevant authorities like Ministry of Health, and also here they need you to reporting even to CBAHI within 5 days, with Ministry of Health within 24 hours, and he will be asking, and we will see this reporting conducted very well or not. I hope, inshallah, in the end of this lectures, at least I know the time is not enough to cover it within 2 hours. 1 hour's last in the last lecture, part 1, and part 2 it is only 1 hour. I do my best. I hope I give you at least awareness or orientation about the standard and what is required from the pharmacist staff to be prepared for, inshallah, accreditation. And I hope all of you will prepare. And in case many of you they communicate with me last 2 weeks, and they asking some document, and I provide to them. In case if anyone they have any questions or any help, I'm ready. You can communicate with me in Twitter, or you can communicate with me through this group. And I hope, inshallah, I do my best.
FADIC, revive your clinical career.